Presentiamo la signora.
We'll introduce this lady to you. I will try and speak with a soft voice because I tend to scream. She has some telangiectasias that we'll treat with spectrum with Dr. Ceschin. We see this reticular vein here that starts at this level. You can't see it when I move away, and it stops here. We can still see it here. Careful, because you're moving the wire.
Non illumina più. Staccato il filo. Ecco. Perfetto. Vediamo. Guardate come si può vedere la vena reticolare.
You can see the reticular vein. Let's see if you can manage. Please come a little bit closer. So if you don't use the light, you can't really see anything else. We have studied the patient already, and we found this reticular vein. You can see it. You can see it. So first of all, we will start with this treatment. We'll cool the plane down with some air. Behind me is the device. This is the fiber. I will just move a little. 200 microns, single use, which is connected to 808 laser. Here you see the fiber. You can see the light here, the guiding light. You can also see the thread that conveys the laser beam to the end of the fiber with the guiding light. We are now ready. We have already disinfected the skin, so we can start. Here is the pedal. You have seen that I had the red and I moved it onto yellow because when I insert the fiber, the red of the guiding light interferes with the red, so we're now ready. I am already underneath the dermis. I am already in the right position. Sorry, Angelo, can you hear me? Because we can't really see. Fine. I've gone out because I couldn't follow anymore the reticular vein. This light is not on. Angelo, can you hear us? Yes. Right now, you're using a percutaneous entry point directly with the fiber, with no other device. Yes, 200. That's a fiber that I'm using, and there is no interference with the skin plane. I am just using the fiber. Thank you. You can see a small hematoma here, a little bit of bleeding. We can already start seeing the contraction of the reticular vein. You can't really see it right now. We'll go in once again with 2 spots. I've gone into the dermis. This is the technique, forwards and backwards, because you're using 808, right? Yes. With this second passage, you see the formation, but the whole reticular vein has already been treated. I set 3 watts, 70 ON, 3 watt, 70 on and 80 off. So with the fluence, which is not really high from this viewpoint. So if we go check, this reticular vein is invisible. The lady is still very quiet. You can see how I can work superficially or more in depth. And there is almost no bleeding, which means full coagulation of the reticular vein occurred. Now, you can't really see it anymore. I will go back onto this point. No bleeding. And you can see this small bruising below the epidermis, in the dermis. So no bleeding once again. We'll just clean a little. This is the minimum bleeding, but there is no reticular vein anymore. This trunk is gone. I'll try and show you a small dot, and then I'll leave it to Dr. Maurizio. At this level, it is not a reticular vein either. It's a very small one. Angelo, can we say that reticular veins can be treated with sclerotherapy as well? It is so. And I would add that we need to mark them thoroughly before the procedure so that you know exactly where the vein lies, even when you can't see it with transillumination any longer. In this case, Francesco, I am sorry for interrupting. There is no bleeding, so it means that full coagulation occurred for the vein or small telangiectasia present in this area. I would say that for reticular veins, this is the result after the treatment. I apply some bandages on the treated area, and I also use a cohesive type of bandage. And I tell the client, the patient, to use compressive stockings. Eccentric compression? Yes. With cohesive bands that leave the tampons in place and the telangiectasia that are treated both with spectrum and with fiber, depending on what I've just used. Thank you, Angelo.